Hello guys, good evening. I was receiving so many queries regarding the structure of this INBD exam or what type of exam it is, how it's being conducted, what is on day one, what is on day two, why it is spanning over 2 days, etc., etc. How to apply for that and what are the requirements to appear in this exam, where it is being accepted, etc., etc., like all these type of queries. So that is why I made this video for all of you. Hopefully it is going to help you to understand, and it will definitely guide you how to get along with this whole procedure of appearing in the exam and what are the do's and don'ts. This exam, INBDE, the full form is Integrated National Board Dental Examination. It is a test designed to integrate the biomedical, clinical, and behavioral sciences and evaluate the dental cognitive skills of international candidates seeking to earn admission into the advanced standing programs in the US dental schools. This exam is replacing the old NBDE Part 1 and Part 2 exams. And this exam is extended over 2 days. This exam is recognized by all United States dental licensing bodies, all the state boards and the American national boards. This exam is a prerequisite to apply in any United States dental school for the internationally trained dentist for an advanced placement program, or even if somebody wants to go for a residency program. This exam can be attempted any day of the year depending upon the availability of seat at the Chromatic center you are intending to take the exam. Or you can check for another Chromatic center which is close to your place where you are planning to go. Well, the duration of the exam is, for day one, it takes almost 8 hours 15 minutes. There will be a break between the two parts on day one. Day two, it is for 4 hours 15 minutes. This exam is being conducted at the Chromatic centers in United States as well as its territories, and also being conducted in Canada. Wherever the Chromatic center is, you can take this exam. When you go to the Chromatic center, you are not allowed to take any of your belongings in the exam area. Only your ID, and that's it. No watches, no car keys. You cannot take your sunglasses, nothing. Your food or your medicines, you have to keep those inside a locker. Locker is being provided by the Chromatic center, and the lock and the key provided to you, they come with the color coded tags. So depending upon what color is there with your key, you are allowed to have an access or no access at all to your belongings during the exam. If you have taken already a permission that you need some food, like patient would be diabetic or whatever, or any liquids or any medicine during the exam, so you will be having an access, but you have to apply beforehand to both the Chromatic center as well as to the Joint Commission of National Dental Examination. Green means full access. Blue, that comes with the consent of the test center administrator. This is how the Chromatic centers mostly look from inside. There are stations where you will be taking the exam. Before you register for the exam, you need to have your dent pen. In one of my lectures, in one of my videos, I have told you that what dent pin is. Well, I will make a separate video in how to acquire the dent pin. This is your personal identification number, which is for life with the American Dental Association. So you have to save your dent pin and you have to save its password as well. If you have already one, you can use that to register for the exam. Then ECE is important for all the internationally trained dentists. Get your official dental school transcripts verified by the ECE or Educational Credentials Evaluators on this website. Before applying for the ECE evaluation, as I already mentioned, you need to have the dent pin. The reason is why you need to get the dent pin before it. JCND will discard ECE reports that cannot be matched to a dent pin using candidate's supplied name and date of birth. Only official reports electronically transmitted from ECE Incorporated, they are going to be accepted by the JCND. Personal reports will not be accepted. Your examination application will not be processed before the ECE evaluation report is received. The name on the ECE report must match the name on your application exactly. Any name changes must be accompanied by the legal documentation. On the day one, there are 360 MCQ items and you must attempt all the items. Day one exam is in parts and there will be breaks between the parts. The MCQs are comprised of basic and clinical sciences. Basic sciences questions are not too deep or difficult, but definitely you need to have good knowledge about the different body systems as well as about the oral cavity, its anatomy and physiology, the oral physiology, etc., etc., occlusion. Clinical sciences MCQs. Well, these are different types of exams like the direct knowledge based type of questions, critical thinking type MCQs with case scenarios in the stem of the questions, case scenario questions with case history with or without a picture. These pictures could be a pathology, the clinical picture of a pathology. It could be a clinical situation, or they may present you with an X-ray and you have to identify either the normal anatomy or you have to identify some pathology on the X-ray. MCQs on pictures with a pathological lesion or an X-ray only can also be there. So there are different variations in these questions. On day two, there would be 140 questions on day two. There will be a break during the exam. The exam will be of the same pattern as it was for INBD Part 2 Day 2. There will be case scenarios with the complete synopsis, pictures, dental chart, medical history, social history and chief complaint. And there would be like 10 questions at an average per case. So anywhere between 8 to 12 depending upon the case, depending upon the exam. We cannot predict. So this is some information regarding the INBD exam. Thank you very much for listening. God bless you and all the best for your exam.